Hey, good morning everyone. Pat Zemer here with Magna Wave office hours. This is a time that I'm live that I'd be happy to answer any questions that anyone has about Magna Wave, about PEMF therapy, about different machines, about how machines operate, anything that you might want to know when it comes to PEMF. We want to be able to be here and answer for you. Our whole deal here at Magna Wave is transparency. We want to be accessible to you, and we want to answer the questions that you want to have answered. So before I do that, I'd like to, for those of you who may not know me or may not be familiar with Magna Wave is a provider of PEMF devices. We've been in business since 2007 as Magna Wave. I've been in the PEMF therapy business since 2002, so I've experienced all types of different machines, all types of innovations and things that have gone on. I am the founder of Magna Wave. I'm a professional practitioner. I spent 7 years on the road, almost 7 years on the road with our device, going to horse shows, chiropractic conferences, any place I could go to show, demonstrate, and educate people on this type of device, the wellness that they can provide, and the services that we provided. So I've treated thousands of horses and people and small animals over the years. I have a secondary education in microbiology and pathology, or a postgraduate studies in those areas. That doesn't mean anything. It just gave me a little bit of background to better understand what we were doing. I'm not a doctor, not a veterinarian. I'm a normal person who got involved with this because I liked it and I wanted to help people. I've been blessed to be a 3-time #1 bestseller with books, one about PEMF therapy, others about dealing with marketing. So that's just telling you a little about who I am and what we're all about. So if you have any questions, please come forward, ask the questions. If you don't want to post your question to where it shows up on the screen or in the post on Facebook, then perhaps you could send your questions to magnawave1@gmail.com. That's magnawave1@gmail.com, and I'll be able to see the questions there, and I'd be happy to answer them in a manner that I don't describe who's asking the question. Sometimes people feel like they ask a question and it's embarrassing because they want to know something very basic, but they just, whatever. Just so you got couple of different places. You can go to magnawave1@gmail.com and ask your questions, or you can post it right here on the Facebook page. And I see we got a couple of folks with us already this morning. Good morning, Maureen and Shelley. Glad to have you, and we hope this information you'll find it beneficial. One of the questions that I get all the time deals with intensity. In fact, there was a conversation this morning in our private group, our private forum, and I'll just show you that here real quick while we're talking about this. Let me make sure I've got the right one up. Nope, that's the... Here is our private forum, and where we have questions that can be asked. One of the people made a comment this morning about they see people treating horses too high or on higher settings, and there's been 10 comments to that particular question. And so that is really a great avenue to have questions asked and presented. Oh, I didn't show it to you. I took it over there to it. There it is. So here's our private forum where our practitioners can ask questions and have them answered. Works out very well. And what I was saying, there's a picture of our new app. Someone asked the question this morning. Actually, they were ranting a little bit about how people treat and different intensities that they use, and there were many comments to that question supporting it and various things like that. And that's a real benefit that we offer here at Magna Wave is our private forum. Over 200 practitioners are in that forum to answer questions that anyone may have with regard to how to provide specific sessions dealing with various conditions or various indications that someone may be experiencing. So it's really a valuable tool for our practitioners. So with that said, I was talking about a question that we often get, and one of the questions posed this morning on the forum deals with sensitivity. and intensity, and how much intensity is required, how much intensity is too much, what intensity is best. And so I want to kind of go over that a little bit and answer some of those issues that a lot of times people have. It is a great question, and really there's two ways to look at it. We sell high-powered equipment, or provide high-powered equipment that puts out a lot of intensity, and so we can go from a very low intensity to a very high intensity. And I'll describe what's good about being able to have that entire spectrum of flexibility. The low-powered companies, and nothing against them, their therapy is very good. There's always a place for all different types of PEMF. Talk about low sensitivity or low intensity being the best, and that's the only way to do it, and that's the only way that it'll work. That's because that's all they have, and I don't mean that wrong, against them, but that's the product that they have, and so certainly they endorse and enhance the intensity that their particular products deliver. And to that end, a lot of the original studies were done with low intensity or low powered devices. And the primary difference between those devices and the devices that the high power companies, or the devices that Magna Wave has, is the high intensity is designed to basically help oxygenate the blood cells, or help the body better oxygenate its blood cells, which takes away inflammation, which will relieve pain, which will set the body up to better heal itself. And it does that in a very rapid fashion. Quite often you can do a treatment for 5 or 10 minutes and you have relief. There is less pain. Inflammation is reduced. Continual treatments will take the inflammation away to where the pain relief lasts for longer periods of time. And so that's the quick value of the higher intensity that our machines deliver. Now, when you come to the lower intensity side, Dr. Bob Dennis in the NASA study kind of came to a conclusion that the lower intensities may help the healing a little bit. And that's a good thing. If you can improve the healing process a little faster with the lower intensities, then by all means, if you get it to a point that you want to complete the healing process or allow the body to complete its healing process, then there's a time for lower intensities. And so that works fine. Our machines go from, as I said, a very low intensity to a very high intensity. So that's where those questions came about, was they found that the high intensity is great for one thing, the low intensity is great for another, and a good mixture really is beneficial. They talk about balance and how to do it. So it's not a situation that more is always better. More can be rapidly effective, and less can be help the healing process and help the overall process, which is exactly what we're about. We like to totally present a system that can help the body's healing process and help the wellness and health and wellness of the people who utilize our types of devices. So I hope that clears it up a little bit, and all these devices, the last thing I want to do is to tell somebody that a particular device is not effective. In fact, to that end, my Thursday Magna Wave Wellness webinar this week, my guest will be Wayne Crusher, and Wayne is the developer of the Easy System, the Centurion Easy System that we have on our website, which is a low-powered device, which is excellent as a healing helper, which is excellent as a relaxation device, but it doesn't have the higher intensity that our Max and our Maya and the Semi machines have. But there's a lot of people that's what they want, and that's what they need. And so Wayne will be with me on the webinar on Thursday. You'll be seeing that promoted here over the next couple of days. So if you are interested in low intensity and you want to hear about the studies and the things that they have done with the Easy System to promote wellness, we'll be discussing that on Thursday on the Magna Wave Wellness webinar. So keep an eye out for that. Let's see, we do have a question. How many times a week should you do a treatment for arthritis? Well, that's a very good question, and I'll kind of explain it this way. When you're doing these treatments, what happens is you do a treatment for an initial period of time, and then it lasts for a period of time. It is possible to do a treatment for some or a session for some issues that you never have to repeat that treatment. Doesn't happen very often, but that can, in fact, happen. Now, when you talk about arthritis, let's just say you're talking about arthritis in the hand, and you go and you do a treatment for 7 or 8 minutes at a higher intensity because you want to get rid of the inflammation. What happens with arthritis, you have a calcium buildup, and the nerves are irritated, and you start having pain. Well, if you can get rid of the inflammation, then you don't have the pain, but you don't get rid of the calcium buildup, or what's causing the nerves to become inflamed and cause the issue. So when you treat, it might only last, first time, maybe a few hours. The second time you treat, it might last a day. The third time you treat, it might last 2 days. And the more you treat, a lot of times, the longer it lasts. Now, the question is the anatomical aspect of the body. If the anatomical issue is severe enough that it's going to start irritating those nerves as soon as you relieve the pain, then it's going to come back. So you treat yourself as often as you need to maintain the comfort that you want. Can you do that every day? If that's what's necessary, yes. Can you build it up to where, let's say, you treat yourself 10 times and it lasts for a week? You feel pretty good for a week, and then it starts to creep back in. Then maybe you have to treat yourself once or twice, and it'll last for another week. So, as Dr. Dreesen often points out, you treat as long as function continues to improve, and then you treat as often as necessary to maintain the result that you were looking for. So, I hope that answers your question. So, you can do it once. You can do it 5 times, and then you're just going to see how long. I always say how long it holds. And but yes, to answer your question, you can treat yourself as often as you need to keep the condition in a manner that you're able to deal with. And I hope that answers the question for you. If you want more clarification, please ask again. Okay, let's see. Here's another question. What intensity, length of treatment, and frequency of treatment per week for sore suspensory on a horse? Vet confirmed no tears, lesions, or holes. Well, intensity in that particular case on the suspensory, the intensity would be, number one, we want to make sure we get rid of the inflammation so the area can heal better on its own. So I would say, but in most cases, you don't need a high, bang, bang, bang type of situation there. You might want to just have it a moderate intensity, which I would say would be something you could count. 1, 2, 3, 4, 2, 2, 3, 4, 3, 2, 3, 4, 4, 2, 3, 4. That being the clicking speed. Click, 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 click. That would be a reasonable intensity. You certainly want it comfortable. You don't need a lot of overexertion to the area. Frequency of treatment. Frequency of treatment would be, in a case like that, if you wanted to do it twice a day for the first 4 or 5 days, and then once a day for a few days, and then every other day. Again, the secret comes down to as long as function continues to improve. The veterinarian's going to look at it and say, yeah, it's feeling better. There's no heat or there's no swelling. Horse is moving on it a little better. The biggest challenge is you get to feeling better. People do this all the time. The horse gets to feeling a little better, and all of a sudden it goes out and gets into the paddock and plays around, and boom, can re-injure itself or exacerbate the injury. So I would treat it a moderate setting. And I always say also in our training, tissue responds more favorably when it's approached from different directions and different intensities. So you might approach it from the side, where you have the coil, the signal's going like this. Well, so if you put the coil here, the signal's going this way. If you put the coil here, the signal is going that way. So if you move that coil around the leg or whatever part, shoulder, elbow, on whoever animal, person, small animal you're treating, you move that coil in different spots, and maybe this treatment you turn it up a little higher, the next treatment you turn it down a little lower, so the tissue never gets used to it. It's always getting energy that here's good new energy coming in. So that's how you want to approach that when you're dealing with those types of those types of situations. And again, that's not necessarily just for suspensory. That can be for inflammation of the knee. That can be for a lower ankle issue. That can be for an elbow. That can be for a hip on a dog. So it's all those same kind of things are going to use a very similar type of guideline for application of the session. Let's see. And that's good. And so no tears, or if there were tears or holes in a muscle, I tore my or hyperextended my MCL on the inside of my knee. And when I went finally to get my vet to do an MRI, he looked at it and said, "There's no tears. I can tell by feeling, and everything seems to be okay, and you're doing the right thing. It's going to take a while to get it to come around totally." But I was very good in about 2.5, 3 months, and he told me it might be 6 months. So on a super hyperextension in that type of situation. So holes and tears certainly extend the length that you have to have something go to be treated. And and Mandy pointed out, using a max. Well, what I described there would really be applicable for most any machines in our line, whether it's the semi machine. Now on the semi machine, it's a little weaker, and so when you have it up on its higher setting, you might want to go 15 minutes instead of 7 or 8 minutes that we would do on the max. In those type of indications. So a little longer, it will help suffice to make sure that you're getting some of the same energy that you want. But again, if you're going to operate the max at a moderate setting, then the semi is a moderate setting in many cases. So hope that clears that up for those of you who are looking at the semi, or those of you who have the semi. The treatment times are really very simple. The process is the same. Doesn't make any difference what device that you're dealing with. So I hope that helps. I'm going to look over here and see the question. Looking into purchasing a machine for my horses, which machine would be recommended? Not sure if the semi would be strong enough. Well, what the difference in the devices, the Max device, the Maya device, the Pulse Pro are all higher intensity devices, and they are a little more versatile. When you're dealing with let's say an ankle issue or a suspensory issue, and let's say you want to turn it up every once in a while as you're doing those treatments to get a higher intensity to really get at the inflammation, those machines will certainly do that job better or quicker. If you're dealing with a foot and you have an abscess or something that you're dealing with on the foot, and you want to have much more intensity, you want to turn it pretty well up. Then the higher powered machines will give you that versatility in a better fashion. If you're running 2 attachments, quite often you can run 2 attachments at the same time. Well, when you do that, you do decrease the overpower of the unit. So if you're using a more high powered unit with the 2 attachments and you have more flexibility to turn it up, you can still achieve the intensities that you're looking for with the higher powered units. Now the semi unit is where you would be talking about for if that's enough to do the horses. If you're doing a nice overall body treatment, or you're going to use the Wave wings to get a nice overall body treatment of the necks, the shoulders, the top line, the hips, that whole thing, it's fine. It's excellent. But if you get a situation, I mean, we can talk a lot about intensity and how much is too much in a horse. Well, if you've got a deep sacrum issue going on, you might need some intensity to get deep enough into that area to really get to it. And that's again where the higher powered machines come in a little more effectively, a little more versatile than that type of situation. But for an overall generalized body treatment, which will, again, they do the same thing. The whole secret behind what we're doing, it's oxygenation. If you can super oxygenate or help the body better oxygenate its blood, then that blood will help relieve inflammation, that will relieve pain, that will allow the body to better heal itself. Any one of our high-powered machines, from the semi to going right up to the max machine, will in fact help that situation. It's an interesting question, but I hope that answers the question for you. Okay, let's see what else we have. Tanya, I hope that did. If it didn't, ask it again and what specific you're speaking of, and I'd be happy to address it. I will share a situation we had just a couple of weeks ago, we were doing a demonstration and a training with a customer who has a semi, and so we were doing the live training. Well, as it turned out, one of the horses we were working on had an abscess. And our young lady who works here, Joanne, owns a horse at that same barn. So she had taken the semi on Saturday to that barn and treated the horse with the abscess. And she wanted to know what would the protocol be. And I said, well, since you're using the semi, I would treat that horse instead of 6 to 8 minutes on a very high setting. I would treat that horse for 30 minutes on high on the semi. And that's what they did. When we went back to on the training on, I believe it was Tuesday, on the hands-on training, we treated that horse again, and the abscess had moved. It was looking like it's going to try to go. We treated that horse again with the hoof pad and box for this time maybe 10 minutes, and that evening the abscess came out. So we're talking about a length of 2 or 3 days with 2 treatments. With the semi. So we were very happy that the semi helped that situation along and got it through faster than what normally would be expected or what could happen. So there's a little bit more a breakdown on how these can operate. Let me get a little drink of water here if you don't mind. So let's see. And then the question is again from Lauren, which machine is best to start out with? Well, I guess that's determined by what you're looking to do. If you're looking to have a device to help the health and wellness of your horse or your horses, if you've got a few horses, then certainly the semi device would be effective for you, would be a very good budget item and would work very well. If you're looking to be in business and you're wanting the best versatility that you can get, then maybe one of the other machines with more power and more versatility may be something to consider. However, we have several people, and I believe a couple of them may be with us this morning, that use the semi in their business. As an aid to massage or an aid to acupuncture, because it will stimulate the acupuncture points. It will soften up the muscle tissue to make an adjustment more easy to apply. So it's really kind of an area. I've had people do it both ways. I've had people start with the semi, build up their business, start doing some things, learn, move up to a max or a Maya or a Pulse Pro type of device, and then decide, now I'm totally covered. And the neat thing about that is then they can, if someone needs to take that semi home and use it for a week on their horse, they can let them do that. Rent it to them, let them take it home for a week, help their horse or their small animal or themselves, and then business goes right on with the other device. So I've had people start with the semi and go up to a max. I've had folks start with a max and then add a semi or another one or a Maya or whatever to their practice, so they're covering all the bases. And so that, I know that's kind of a roundabout answer to your question, and I don't want to. Again, our deal here at Magna Wave is we want to help you. We don't want to say, oh no, you have to buy this machine because that's the only one that's going to do this. Well, that's not the case. Now, for years, that's all we had, and that's all that was available, and that's all people could buy. I'm sure there's people that say, gee, I wish I could have done it differently, and frankly, we wish it could have been done differently as well, but it just wasn't available on the marketplace, and now it is. So I hope that helps answer your question. Maureen Boyle writes, my semi is fabulous, might take a bit longer, and that's what we were talking about. It can take a bit longer, but it does a fine job. And just think, if a person, if budgeting is not an issue and you had 2 or 3 machines that you could either have helpers or you could have moving around the community, that's a pretty sweet deal. So the business package can be developed however you would want to do it. Let's see. Any recommendations for a 12-year-old horse that is pasture sound with PSSM? I have a semi. Well, I would say Aaron, our training specialist, who is I think, I haven't heard, but about ready to have a baby. She may have had it last night. She may have it tomorrow, on the edge. But at any rate, Aaron always says, put it on and treat. And what that means is, and here's another generalization with this kind of product, what we're doing is helping the body better oxygenate its blood, which means you got good healthy blood cells circulating through the body, working on any indication that it comes to. There are a lot of diseases that develop because of stress and the lack of oxygen in the body. If we can improve the oxygenation, we can work on those problems and allow the body to work on those problems. So in that type of situation, simply treating, now how often you treat? You might treat several times to again try to get ahead of the situation and then see how the function improves, and then you'll have a way to go. So that's my recommendation, and I don't, put it on and treat regularly and see how things develop from that perspective. Let's see here. Here is another question. Mandy says, I absolutely love my Max. I treat so many different situations and clients with different needs that I would not go any other way. AT box on wheels is so convenient. Thanks, Mandy. I really appreciate that, and I did not ask Mandy to do that, put that up as a commercial, but we really appreciate it, and we love it. It's rewarding to me when people can say how much they're enjoying what they're doing. We have a little sign on our wall out here when you come in the door, love what you do, and that's so key. If you're liking what you're doing, you're going to be successful. And when people can see that you like and you believe in what you're doing, then you can be successful. It can take time. I mean, it's not an easy road. It wasn't fun traveling around the country 7 days a week for 7 years trying to educate people and show them what it would do. It was fun in that we loved what we were doing, but it was hard work. And you got to do hard work in order for things to balance out how you'd like them to play out. Another question here is, I do barrel racing, so I want to upkeep my horse's body, keep my horse's hocks and stifles. She has hind end issues as well. I'm guessing the Pulse Pro would be a better choice for this. I would like to treat a few horses on the side as well. Well, absolutely. The Pulse Pro, the Maya, or the Max, actually the Semi would be beneficial for what you're doing to care for your own horses. It comes down to that question that I present again on the versatility of the machine and what it can do in specific instances. But that's a good mid-range price machine. It's a good mid-range power or a good power machine, so it could very well suit the needs of what you're looking for, Tanya, and if you want to discuss that further, we're certainly here to talk with you. You call the office or call me. My cell number is 502-271-8400, and I take every call I can take, and I'm happy to do that to make ourselves available to answer your questions and help out with that. Morgan, thanks for the thumbs up. I just want to say that I'm enjoying this. It's great to see the office hours begin to pick up with people tuning in to learn and get the questions answered that they're looking for. I better check. Let me look over here real quick and check my Gmail to see if there's been any questions pop up in there. Nope, no questions on the Gmail, so good. So most folks are asking the questions right here on the Facebook Live presentation, and we've been at it now for about 30 minutes. Great questions. I love it when people ask things and they really want to find out what the answers are to their particular questions. So if you have any other questions, please put them up there, and I'd be happy to approach it. If not, then we'll go for another couple minutes to give folks a chance to ask any questions that they may come up or think about. I hope that answers your question or some questions that people have had about intensity. And again, I'll say that it all works. It's just how fast it works. And that's the thing. Frankly, we're having this conversation this morning because when I started doing this, it worked fast. I could treat someone's horse or treat their dog, and the dog would get up and walk off in a better condition than it did when he sat down or we treated him for 10 or 15 minutes. And the same thing happened with horses. People want instant gratification. And, that everybody says, well, that's what everybody wants, and isn't that a shame? Well, it is a shame. But when it comes to health and wellness, the better and the quicker we can become healthy again, the happier we are. and to keep our animals, our pets, healthy and happy. That's very important. And the same thing for ourselves and our horses. So it's the speed of result that folks quite often are looking for. And let's see here. Also, I'm from Canada. Do you have any distributors for the machines there? Yes, we do. Our distributor in Canada is Dee Loonsberry, and we can put her in contact with you. If you go into the system and request some additional information, we'll see that you're from Canada, and we'll put you in contact with Dee and help get your questions answered and help you in Canada. She does an excellent job, and again, we're here to answer your questions as well. So thank you for the question about Canada. Canada is a very quickly expanding market. My goodness, I mean it's a big place. Someone in Calgary, that's like going across country in the United States to go to Ontario or some other places, and so big territory there, and a lot of opportunity in the Canadian market to help people and animals get well. All right, let's see another question. I have an older cat that has some joint issues. Should I try to use the machine on her myself or seek a vet that offers Magna Wave therapy? Well, cats love this therapy. I mean, they'll lay on the coil waiting for you to turn it on. And it is very effective. When you talk about joint issues, whether we're talking about a dysplasia type of issue or an arthritis type of issue, whatever it is, the machine will help do a job. It doesn't make any difference if it's a cat, if it's a dog, if it's me, if it's a horse. If it's a joint issue and it can be helped, now, if it's anatomically messed up, then you got an issue. But if it's something that can be helped, then the device can help with the oxygenation, help with the inflammation reduction, help with the pain relief, and help the cat be happier. So for sure, I've had people buy devices to treat just their dog or just their cat, or Lyme disease is the amazing thing. The number of people that have purchased devices over the years for themselves for their Lyme disease because it helps them feel better, and in many cases it helps to change the symptoms and let them live much more comfortable life. So yes, if you don't have a machine and there's someone in the area, you can go to our website. It says PEMF near you. Put in your state. The people in your state will come up, so someone can be nearby. It'd be great. Go to them and get some treatments and see if it helps your cat, and you'll be very happy. And so that if there's somebody in your area, it doesn't, many veterinarians have it, but if there's a practitioner, massage therapist, acupuncturist, soul practitioner, they're there to help you and your cat feel better. So, a great question. A lot of people, it's funny how somebody thinks, will this work on cats? It'll work on chickens. It'll work on pigs. We've seen people treating squirrels. There was a squirrel that had trouble balancing itself when as it skirted across the trees and such, because it had a tail problem. And they treated the squirrel's tail to help him regain some health and improvement, and away things went. So yes, it will work. Okay, here's another question. Let me move this here a little bit so I can see the whole question. I have a client that has a dog with a hemo, I can't read it, cytoma. She has had it Magna Wave before, but I was less comfortable Magna Wave, a cancerous tumor, without further investigation. What are your thoughts? I also have a client with tendonitis in her left elbow. We have been Magna Wave her 1 or 2 times a week for about 3 weeks, and she's not seen much improvement. Any advice, and also what would be helpful? Okay, 2 things, two very different questions. Certainly, when you start talking about tumors and cancerous situations, you need to know what your veterinarian feels and what the veterinarian recommends. There have been some veterinarians and people who have treated tumors with our device and devices like ours that have seen tumor reduction. They've seen reversal in how things are going. But again, it's very important to know specifically what you're dealing with. But we have had, Dr. Marty has talked about it on the webinars and our podcast section. If you go to About Magna Wave and look at the podcasts, there are some. There's a podcast with Dr. Marty Goldstein, Dr. Alice Maybank, where we talk about tumors and those types of things, and they have seen some very good results in those areas. So it's certainly something that looks very promising as a form, as a guideline for sessions. So I hope that. With the person with a tendonitis in an elbow, it can take, when you have if you have a situation that's been there for years, it's not going to take years to get rid of it, but it could take some time. You got to remember that when you finish your treatment, they go right back using that elbow. They're doing whatever they're doing that's causing the problem. That continues. And so that's the challenge, to get ahead of that situation. I don't know what intensity you're using. I don't know how long the treatments are lasting, so I can't really address that. But I can tell you, in my wife's situation with herniated discs, for those of you who've heard this story, I apologize, but she has 3 herniated discs and some other issues that the doctors wouldn't operate on her because of some heart issues with an implant and so on and so forth. But so we started treating her, and we treated her every day for 30 minutes on a pretty good intensity for 30 days and stopped, and she got 2 weeks of relief. When we first treated her, she'd get a day or two or maybe some relief. And then, so after that first 30 days, we treated her for 30 days again, every other day this time. We treated her every other day for 30 days, and we stopped, and she got 4 weeks worth of relief at that point. So we thought, hey, let's go back and do this again. So we'll treat her for another 30 days, and maybe we'll get 6 weeks of relief, or maybe it'll go away. So we treated her again 30 days every other day, and she again got 4 weeks of relief. Now this goes back to 2007. So for the last 10 years, every 30 days or so, she'll treat herself once or twice, and she gets another 30 days of relief in her shoulder. She couldn't raise her arm above here, and she was in pain all the time. And the first time she got her treatment, sat down at a conference, they said, we'd like to have a volunteer. She looked at me and said, this isn't going to help me. This is how we got in the business. She said, this isn't going to help me. And they said, I'll show them. So she went down, sat down, 8 minutes on a machine. She stood up, total mobility, no pain. She was sold. She was a buyer, and we were in business. Had to be in business. We had to pay for this machine. But it went away in a couple of days. So she went back into that's when we started the routine. So in the tendonitis, it could be something that could take 60, 90 days worth of treatments, could take varying intensities. Maybe you really have to get at it with intensity initially to get it to where it's more in control, but then you can maybe use some more moderate intensities or lower intensities to help that particular spot heal. So, and it's going to happen. There are situations that aren't going to improve because there could be a pinch there that you can't relieve. And it's pinched, and when you quit your session, it's pinched. And they do their elbow, and until we can figure a way of doing that, if they've been to a chiropractor or had it looked at, or what's causing it? Could there be a spur there that's causing the problem, causing the pain, causing the inflammation? Who knows? But if you wear the wrong shoes to the fair and your back hurts, if you go to the fair the next day and wear the same shoes, your back's going to hurt. So, you just got to keep that in mind, that it could take some time. I hope that helps with the 2 different questions. With the tumors, I take a look at the hydro wave water, get the good oxygenation in the bloodstream to help. Cancer does not like oxygen, so if you can have your body very well oxygenated and good oxygen flowing through the body, that could could potentially do some work that the body tries to do in those situations anyway. We just need good oxygenation and health to help out with that. I will point out one thing. If you're treating a client with a tumor or a cancerous situation and they're using chemotherapy, don't use Magna Wave, PEMF, or any other PEMF device. Why? Because it aids in the metabolization of whatever they're taking. And quite often when people have chemotherapy, they don't feel good. They get sick. And we certainly don't want to treat them with something that's going to make more of that in their system. We don't want to make them sicker, and we don't want to have any involvement with that. So that's just that is a contraindication. If someone is taking that type of medication and it tends to make them sick, you don't want to do anything while they're doing that. Once they've completed that, and you want to help their back, or you want to help their body better oxygenate itself, that's fine, and that has a tendency to work out very well. So I hope that answers those questions for you. Great questions, Jacqueline, and I certainly appreciate those questions. Any other questions, folks, please throw them up there, and we'll answer them. And this all will be repurposed. It'll be available for you to see on certainly the Facebook page. We'll chop it up and have it in smaller question and answer spots that you can in fact get it in that manner. We'll put it as posts on the website. We want to make sure that these questions get answered and available. We'll probably put these on the podcast page so someone can come watch. The only challenge is it's many different topics, and we like the podcast to be on a set topic through the podcast. So you're helping me, and you're helping others by asking these questions, because it's amazing when I'm dealing with the phone all day long and people are asking questions. Someone asks a question, I think, gee, me, it's been a long time since anybody asked that. I've had to think about it here for a minute, but we want to make that content available to you. Thanks for the thumbs up, Elizabeth. Thumbs up to you guys for coming here today and being with me. We've been on now about 42 minutes, so we really appreciate you being here. Any other questions? We'll wait maybe another minute or so to take any questions. I got another meeting at 10 o'clock that I need to be off to. So we could, if we had the activity, we could keep going if people wanted to be here. Again, it looks like things have kind of slowed down here a little bit. Answered the questions for those who are with us today. And again, we thank you so much for being here. So I'll be back at 2 o'clock this afternoon with another topic and another round of questions. For those who want to be around at that time, you know how it goes. You're good this morning, but you're not available this afternoon. Well, I want to be here to answer those questions. So, folks, thank you so much for joining me this morning. We really appreciate it, and we wish you the greatest day ahead, and wave on. Bye.